What's up, everyone? It's Prabdeep here with Channel A's Pance, and today we're going to talk about cardiac tropism. So, without further ado, let's get started. So, today's video is going to address the following issues. Number one, we're going to define what cardiac tropism is. Number two, we're going to understand the different types of cardiac tropisms. And finally, we're going to learn how this can be applied clinically. Why this is important for us to learn. Because at the end of the day, that's the most important question. So, cardiac tropism basically describes the effects of external stimuli on the cardiac muscles. And this is done through three mechanisms: chronotropic, ionotropic, and dromotropic. Chronotropic refers to heart rate. Ionotropic refers to change in the force of the contractility of the heart. Dromotropic alters the conduction system mainly in the AV node. Now, all these mechanisms have both positive and negative effects. Positive effects will increase the cardiac output. The negative effects will decrease the cardiac output. And by definition, cardiac output is the amount of blood being put out into the periphery per minute. Now let's discuss both the positive and negative effects for each one of these mechanisms. So for chronotropic, we know it affects the heart rate, and heart rate is mainly controlled by the SA node, and its intrinsic rate is 60 to 100 beats per minute. But the heart rate can be increased and decreased with the help of the nervous system. The sympathetic nervous system, when activated, will increase the heart rate, and parasympathetic nervous system will decrease the heart rate when activated. So the way chronotropic agents will alter the heart rate is by acting on the SA node. It will either activate the sympathetic nervous system or inhibit the parasympathetic nervous system to increase the heart rate. And on the other side of the spectrum, in order to decrease the heart rate, it might activate the parasympathetic nervous system or shut down the sympathetic nervous system. So the point being here is that the chronotropic agents will work on the SA node, the pacemaker of the heart, to alter the heart rate. And now ionotropy focuses on the contractility of the cardiac muscle, and the contractility is controlled by the calcium ions. If there are an increased amount of calcium ions, then that's going to increase the force of the contraction of the cardiac muscle. If there are decreased calcium ions, then that's going to relax the heart and decrease the force in the contraction. So ionotropic agents are going to be focusing on the concentration of the calcium. Positive chronotropes are going to increase the concentration of calcium, and negative chronotropes are going to decrease it. Alright, lastly, dromotropes are known to affect the conduction speed of the AV node. And as we know, AV node is known to slow down the conduction between the atrium and the ventricles, so it can allow the ventricle to fully effectively fill right before contraction. This is what allows for the forward flow to happen. If both atrium and ventricles were getting excited by the electrical impulses at the same time, then there will be no way for the ventricles to fill up properly and the atrium to empty out properly. So, with the help of the AV node, it allows the atriums to fully contract, push the blood volume into the ventricles. Now, as the ventricles are being filled, the conduction gets slowed down in the AV node, and once the ventricles are fully filled, the impulses from the AV node then get passed through the AV node and go into the ventricles, causing a contraction and pushing the blood in the ventricle into the periphery. I hope that makes sense. Now the dromotropes are going to affect the AV node. The positive dromotropes are going to increase the conduction velocity in the AV node, therefore decreasing the pause between the atrium and the ventricle. And negative dromotropes are going to do the opposite. They're going to slow down the conduction speed in the AV node, therefore increasing the pause. Now, with the positive dromotropes, since we're decreasing the pause and we're increasing the conduction velocity, the cardiac output is going to increase. And the opposite is going to happen with the negative dromotrope. Alright, so we're almost done with the video. But there's one question remaining, and that is, how are these terms clinically applicable? Well, these terms can be used to understand cardiac pharmacology. Once we've gone over cardiac pathologies and understand what the underlying problem is, then it will be easier to use these terms and come up with the appropriate management plan. Now, what do I mean by that? Let's say a patient comes in with a tachyarrhythmias, right? So we know there's an issue with the heart rate. And there's only one thing that deals with heart rate, and that's chronotropic agents. So if the heart rate is high, you want to bring it down, that means you need a negative chronotropic agent. Now, if on the other side of the spectrum, a patient comes up with a bradyarrhythmias, then you need a positive chronotropic agent. I really hope you guys get the point that I'm trying to make here. Later on, when I'm doing cardiac pharmacology, I'll identify the properties of each drug class, whether if they're chronotropic, ionotropic, or dromotropic, and if they have a positive or negative effect on the cardiac output. And if you know all this stuff, it will make it very easy for you to come up with a management plan. Trust me, guys, if you guys know these little things, cardiology is going to be very fun to study. So yeah, that marks the end of the video. I really hope this was helpful. And if you did enjoy watching the video, then please like, subscribe, and hit the bell button for future videos so you don't miss anything. And yeah, that's it, guys. Hope everyone stays safe. Stay tuned, and I'll be back next week.